Awesome. And so, could you talk about the types of conditions and diseases that you really think holistic medicine benefits the most?
In my experience, really any condition could be looked at from the perspective of Chinese medicine and Western together. But certainly the things that I find I gravitate most towards in terms of managing arthritic pain, or any kind of pain really. It could be spinal pain, pain from nerve root entrapment where your nerves come off of your spine. Once arthritis progresses in a joint is then remodeled, that's called degenerative joint disease, trying to deal with that. And then with animals that have cancer, certainly helping them to deal with the pain of their cancer. Pain is very often seen with almost any cancer, helping them to deal with side effects of their treatment from their chemotherapy or from their radiation. And still also focusing on the fact that most patients that have cancer are older pets. And so if we suddenly stop forgetting about trying to manage their joint discomfort from their arthritis, then they're going to not feel so well. And then we start questioning, are they not feeling well because of their cancer? Or are they feeling well because they're in pain from their geriatric conditions? So really kind of a pain management practice is primarily what I do, and the most common application is arthritic pain or cancer pain.
Do you have any thoughts on different schools of Eastern medicine, holistic medicine? For example, the Chi Institute being more geared towards Eastern medicine, whereas CSU's program being based in science and kind of the best option for someone as a practitioner or so on.
That's a good question too, because when you're considering undertaking one of these programs to educate yourself, it's a lot of time, it's expensive. Besides just the fees of going to the school, you have your travel, you have your lodging, so it's a big undertaking. And so I think Chi Institute is great. Actually, some of my professors at my IVAS program, the International Veterinary Acupuncture Society, were from the Chi Institute, like Dr. G, who has his own line of herbal products, TCVM herbal, that I use very frequently. The CSU school, I don't know as much about, but I think I gravitated towards IVAS because it seemed like a nice blend, an appropriate blend for me of science, which you can prove, like neurology and things like that, and then Chinese medicine, which is a little bit harder to prove, but still has a good foundation considering it's been used for thousands of years. I mean, Chinese medicine for animals actually existed before conventional Western veterinary medicine even existed, so we really have a lot to learn from them, actually. So I think really kind of recognizing what do you want to get out of your program. If you really want more of that Western perspective, go to CSU. If you want very, very Eastern, go to Chi. If you want somewhere in between, then probably IVAS I think is good for you. But also you think about where are you going? I wanted to go to San Diego. I was living in Seattle. I wanted to escape the Seattle gloom in the wintertime and get down to some sun. So that just worked out well for me.
Do you ever encounter stigma for pursuing this field?
In pursuing veterinary medicine or pursuing a complementary type practice? I'd say very, very infrequently, and I think the time it tends to come, the places it tends to come from are people who are very old school, older veterinarians who just aren't really as aware of this kind of evolution of this practice style, or people who are very, very Western in terms of being internal medicine specialists. It's amazing when you try to talk to a certain internal medicine specialist about foods and how food energy affects pets and the quality of the ingredients that goes into food, and a lot of times they don't even want to listen. They just want to know what food is going to treat what particular illness that they're managing with, like a kidney diet for kidney failure, a liver diet for liver failure, but they don't stop to think what actually is going into the food. Is it a pet grade ingredient or human grade ingredient? Is it a real muscle meat, or is it a protein source that's based in grain? And so that's where I think the ball is being dropped right now, that hopefully I can be part of the process of educating people like that about the value of holistic veterinary practice and whole food nutrition in the future.
Awesome. And so what advice do you have for students that might be interested in the holistic field?
Well, that's a very open question. I think if you do have that interest, then certainly starting to familiarize with different options. Anybody could really be a holistic practitioner, and certainly getting some kind of education along the lines of holistic practice is good. Like most acupuncture training programs really focus on looking at disease a different way, and that kind of blends with holism. But then there are even very specific teachings that you can go to, like Chinese medicine, food, energy, Tuina, all sorts of different and kind of more unusual practices. But as a student, maybe joining a club, if there's a holistic veterinary medical association club, being a student member of the AHVMA is an option as well. So kind of aligning yourself with those principles and introducing yourself to people who practice that style, so you can see how it works actually on a clinical basis. Because you can like the idea, you can think it's interesting, but until you actually submerge yourself in it, you might not realize fully what you're getting into. Because it is different, and every day is a learning process doing it, and there's a lot of unknowns. Like if I have a question about, I work with so many cancer patients, and these people come into me with like bags of supplements that the animals are getting, and they read on the internet that, oh, I need to give this, I need to give that, I need to make this special cocktail, and there's a lot of, I don't know if that's going to help, I just hope it doesn't hurt. So I try to educate my clients on not having multiple combinations of the same thing going into pets, really looking at ingredients and things like that. So there's a lot of unknowns out there that you might not be able to answer, and you have to be comfortable with the fact that you may not know the answer, and then figure out how to appropriately guide the client on it.